Hi, I'm Peter Boland, and welcome to More Health, Less Healthcare, the podcast. I'd like to start off by trying to distinguish between two concepts that we often conflate: health and healthcare. They have different meanings, they have different values, and they certainly have different investment priorities. If you look at healthcare as an industry, it's more accurate to say it's a sickness industry. It's sickness care delivery. I'm not making a value judgment, I'm just trying to be accurate. On the other side, when we talk about health, that's more in terms of preventing sickness, preventing illness, and intervening with other strategies and programs to maintain health, and when illness does occur, to make the appropriate referral as soon as possible. So I want to distinguish just as a level set because words have a lot of meaning. And if we look at what the funding level is, the disproportionate funding level, that again is the cultural value that we have put much more emphasis on healthcare delivery, the sickness part, than we do on health promotion and prevention, the health part. And if you look at the disproportionate amount of funding, roughly 97% goes to sickness care, and much of it in the last few weeks of life. And the other 2.5, 2.7, 2.9, 3 at the most, goes to health promotion, what I would call health. Now that's a wildly disproportionate level of investment. And if you look at what do we get, bang for the buck. Einstein had that adage about if you keep doing the same thing time and time again, getting the same result time and time again, that's the definition of insanity. Well, I think it's apropos to understand and appreciate as a culture, not just as a business sector, that if we don't change our priorities, our investment priorities, we are going to get the same thing time and time again. And as a point of reference, it's worth looking at, why did we lose 1.2 million people? Why did other countries, and holding constant for demographic differences, why did other countries, other rich industrialized countries, why did they lose far fewer people? Why did they incur much less morbidity and sickness? And the answer is striking, is that they invest historically, and as a culture, their values, their priorities, they have invested in social health as a national priority. And we have not. In fact, many of those same countries are investing twice as much, a multiple of what we invest in making the population more well. So I want to use that as a barometer that if we think we are the most advanced country in the world, and we're not, then that has the power of a cultural myth that papers over all the things we have to look at more critically. So one of the things I want to pursue as a priority with you is that let's inject more critical thinking to the healthcare industry and the health promotion industry to understand clearly what is at stake. What are the gains that we can accrue on the sickness side? And what are the gains that we can accrue on the more health side? So if COVID was not a wake-up call, then I really have to, what is? If 1.2 million people are not a wake-up call, what is? 2.4? 4.8? It's a reflection of, as a society, as a culture, what do we value most? I'm going to try and make the case that we should value health the most. Now, the second is that, focus I want to take is, especially the next few months, is that there are a number of organizations around the country that have basically figured out, it's a bottom line consideration as well. They have figured out if we put more investment to basically reduce the amount of sickness care In the long run, we're going to save money, but it's also the right thing to do for the right reason. And I think it's important to stress for the right reason, because if we don't have the right reason, times get tough or budget priorities and organizational compression happens, we may revert to the mean, which is back to the norm. So what I want to say is that the right reason, the values, the centrality of the values and the priorities make a huge difference. So what I want to stress in the next couple of months going forward is, what are those organizations, at least a sample of the organizations, rural and populated and big and small. What is a cross-section of those initiatives? I would call them health equity initiatives. What does a cross-section seem to indicate to us in terms of the efficacy of that kind of investment? What kind of methodologies seem to be working? What kind of results seem to be working? Bottom line, it's a different ideology. It's a different frame of reference, right? So that was a genesis why I spent some time looking at this around the country, and we came up with a very large publication, like 600 plus pages, called the Health Equity Case Studies Handbook. And it really presents a very positive picture of what can be done, and in my mind, what should be done. And whether your interest is more on terms of what health plans are doing, or delivery systems, or even community organizations, go to one of three URLs. If your interest is primarily delivery systems, go to bolanddeliverysystems.com. And if you want to look at health plans, bolandhealthplans.com. And for community organizations doing some very, very imaginative cross-cultural collaboration, go to bolandcommunityorganizations.com. And these are downloadable, free of charge. The second thing I also want to look at, beyond just what the focus is on advancing social investment, the third thing rather, is, do we really understand the context for the problem sets and challenges that we're looking at? And I know that I've been in the healthcare sector for 45 years as a management consultant, whether it be with hospitals and medical groups, health plans, investors, employers, pharma, right across the board. These are difficult, complex, seemingly intractable problems. And what I want to begin to point out, part of the context of what we look at has to be about values and priorities. And I know that we kind of dismiss the notion about, well, we have a healthcare cost crisis. Well, it didn't just start the last couple of years. I remember, 40 some odd years ago, I was a senior policy analyst for health and welfare in the state of California in the governor's office. And at that time, a number of the employers in the state were very concerned about mounting healthcare costs. And there were a number of employer cost containment coalitions that sprung up in California and in many other states. And what the employers were saying is, look, healthcare costs are killing our bottom line, and they're robbing employees of wage gains. So that was an issue way back then. It's still an issue. And if we look at the last 20 years, those same employees have gotten wage gains every 1 to 2 years, but 100% of those wage gains have been wiped out by healthcare costs. So if that was a crisis way back then, and it's still a crisis now, today, 20 plus years, 30 plus years, 40 plus years into this crisis, is it really a crisis? I mean, at some point, a crisis is no longer a crisis, right? It's just normalcy. We have normalized the social harms that excess costs have. And I can't say it more clearly than that. We can't normalize those things that we merely accept because we don't have the courage to look critically at them and to figure out what are the piece parts we can actually do something about. And I also remember, back many, many years, I think it was 2005, I read this book called, it's by Francine Kaufman, who's a very, very astute physician whose clinic was more and more diabetes patients were coming in. And she also realized more and more people in her practice were obese. And she put the two together. And the book was titled Diabesities, right? Diabetes and obesity. And what her concern was is that if we don't have appropriate intervention at scale, that's a critical factor, it's going to get worse. Now, that was 20 years ago. But if you look at 2005, when her book came out, the percent of population that was obese was, 24%. Now, 20 years later, 2025, that percent has now ratcheted up to 37%. Now, you don't have to be a statistician to realize if you trend this up another 20 years, what are we up to? 57, 58, 59% of the population is obese? Now, GLP-1 is a wonderful intervention, but GLP-1 is not the answer. And what I want to reinforce here is that at what point do we intervene? At what point do we intervene at scale? Because it's going to be a whole lot less suffering if we do it now and a whole lot less cost. But I'm also reminded that there's also another tsunami that is at our doorstep. If we're concerned about diabetes and obesity, are we not also concerned about hypertension? Hypertension and all the metabolic conditions that come with it. It is going to be a tsunami that can sink the healthcare system. And what I'm wondering is that what I'm posing for you today is that, do we have the courage to understand where this tsunami is going? And do we have the courage to say, we have no choice? Ethically, as a society, we have no choice but to intervene and at scale today. We owe it not only to our current generation, but to the next generation as well, because what we're handing to the next generation is a very, very unwell, normalized population. So is this a crisis? Yeah, it is a crisis. But do we have the courage, do we have the fortitude to look straight at it critically and understand what interventions at scale can we commit to? And I'm not talking about a quarterly profit statement. That's ridiculous. I'm talking about a 10-year commitment to begin to shape and reshape our society, our investment, our priorities based on health, what is best for the nation. And I think maybe the fourth thing I want to talk more about in the coming year is that, has the healthcare industry as a whole and its component parts, have we reached the point where revenue maximization is now the predominant ideology of the industry? And this is where I get into uncomfortable questions. And I would go further and say, is this the point that healthy profitability is no longer acceptable? That profitability for its own sake is now what the norm has become. And there's a difference between healthy profitability and an excess profitability, because all the financialization practices that are built into a system that's gone too far to one side creates enormous social harm. And I think one of our agenda items has to be to look at those financialization practices that do cause serious social harm to the same consumers that they're supposed to be serving. I think there are intelligent, focused ways to begin to look at what those social harms are and how to go about ameliorating what the impact is on society. And it raises it's almost a philosophical question of, as a society, what level of social harm is acceptable. How much suffering, how many deaths, how many missed opportunities are willing to say, that's okay. We can accept that. That's part of who we are. I don't think it is. I think we can do a whole lot better. So, I mean, I'd raise the question: can the healthcare industry happen both ways? Now, the healthcare industry as a sector, we do a lot of good, absolutely. But at the same time, there are all these unintended consequences of creating harm. So this is part of one of the conversations I'd like to have in the new year. Can we thoughtfully look at what are the harms and how do we ameliorate them? Because that's part of our duty, I think, as a society. So I know that, the Hippocratic Oath says, first, comma, do no harm. Well, I think we need something like that for the whole industry, sector by sector. So I guess one of my parting comments here is that, do we have the courage to look at this and begin to understand the context for these issues and begin to think through these very difficult conversations that we have to have in order to come to a resolution that, yeah, health is number one, because without health, without a healthy population, without a healthy working population, we're not going to have a healthy economy. And as I see it, from an outside analyst perspective, we are basically robbing the next generation of prosperity. If we don't get on top of this in the foreseeable future, we are passing on a burden, a cost burden, that's going to rob the next generation of prosperity. So I realize these are tough questions, admittedly, but unless we have these tough questions, the next generation is going to have to deal with it as best they can. And I think that's unacceptable. I think we can do a whole lot better. So those are the kind of issues I'd like to raise in the coming months with you. And I'd invite you to tune in. And I think we'll both learn a lot. And I want your feedback. That's very important. So Peter Boland, thank you very much for tuning in. See you next time.